Hello and welcome everyone. Thanks so much for joining us for today's Lunch and Learn event. I'm Ellen Bayer, a senior editor at Health Affairs. Today's event is being held in conjunction with our April 2025 theme issue on food, nutrition, and health. And I can't think of a better way to complement the issue than a conversation with one of America's most renowned experts on food and nutrition policy, who the New York Times has called one of the most influential framers of the modern food movement, Dr. Marion Nestle. Dr. Nestle is the Paulette Goddard Professor of Nutrition, Food Studies, and Public Health Emerita at New York University and a visiting professor of nutritional sciences at Cornell University. Her research and writing examine scientific and socioeconomic influences on food choice and its consequences, emphasizing the role of marketing by the food industry. Dr. Nestle has authored, co-authored, or co-edited 15 books, several of which have been award-winning. She previously served as Senior Nutrition Policy Advisor in the U.S. Department of Health and Human Services and as editor of the 1988 Surgeon General's Report on Nutrition and Health. In conversation with Dr. Nestle is Dr. Angela Odoms-Young, who is the Nancy Schlegel-Meinig Associate Professor of Maternal and Child Nutrition at Cornell University, where her research explores how social and structural factors contribute to variations in dietary intake and diet-related chronic disease in the U.S. Dr. Odoms-Young has played an active role in shaping U.S. food and nutrition policy through her work advising the National School Lunch Program and School Breakfast Program, as well as the Special Supplemental Nutrition Program for Women, Infants, and Children, the WIC program. She also served as vice chair for the 2020 Dietary Guidelines for America's Scientific Advisory Committee. We're grateful to Dr. Odoms-Young for serving as an advisor to Health Affairs for our food, nutrition, and health issue. Following the conversation, we will have some time for audience questions. You can submit your questions to Dr. Nestle and Dr. Odoms-Young through the Q&A tab at the bottom of your screen at any time during the conversation. You don't have to wait for the Q&A period. And with that, I'm pleased to turn it over to Dr. Angela Odoms-Young.
Thank you so much. And thanks to Health Affairs for the invitation. I'm very excited to host this conversation with Marion and really just have an opportunity to explore the extensive experience that you have in the areas of policy, nutrition policy, and public health in general. So it really is a great pleasure. We have some prepared questions, as you know, that we're going to discuss, and then I'm going to open it up to the audience to submit questions. But again, you can submit questions throughout. So, Marion, I just want to start out. Of course, everybody knows who you are, but I just wanted to start out with a question. Who is Marion Nestle? How did you get here?
Well, it's a long trajectory. I wrote a memoir that came out in 2022 that basically was designed to answer that particular question because it's one I get asked all the time. I have a really long career teaching nutrition and food. It's more than 50 years now. My first class was in 1975. But I have sort of key points. My training was in molecular biology. That's what my doctorate is in. And I went to Brandeis University as a postdoctoral fellow and later as an instructor. And Brandeis had this rule that you could only teach the same course 3 times in a row because they didn't want their biology instructors to get stale. And when it was time for you to stop teaching whatever you were teaching, you had to pick up whatever the department needed, whether it was anything you knew anything about or not. And when my 3 years of teaching cell and molecular biology were up, the students were saying they wanted human biology courses. And so I was offered either human physiology or human nutrition, and I picked nutrition. A life-changing choice. And as I'm fond of saying, it was like falling in love and I've never looked back.
That's great. And I forget that you had that background or have that background in molecular. I think one of the things that is sort of increasingly evident is how do we link sort of the different aspects of nutrition? We think a lot about policy in our area, but you know, here at Cornell, we have this kind of continuum of molecular to policy. How do you think, and I want to talk a little bit more about the policy area, but since you have so much experience in nutrition, what do you think are some emerging issues that we need to think about sort of across the nutrition continuum? You've been sort of everywhere from molecular to now more population health and policy. What are some key issues that you think nutrition, in the field of nutrition, we need to be thinking about right now?
Well, I'm a big picture thinker, as I also am fond of saying, the world is divided into lumpers and splitters. I turn out to be a lumper. And what I mean by that is that I'm standing back at 30,000 feet and saying, what are the big issues in nutrition? And they're the ones everybody knows about. There's not having enough food, what is now called food insecurity or hunger or malnutrition, a worldwide problem that affects 1 or 2 billion people in the world. And then we have, ironically, chronic disease, obesity-related chronic disease, where people are eating too much of the wrong kinds of food and developing type 2 diabetes, heart disease, certain kinds of cancers, overall mortality, and the whole works. And this is now affecting enormous components of the population, 2 billion, 4 billion, whatever, even in every place but the poorest countries in the world. People are overweight and at risk for type 2 diabetes, and countries are scrambling to figure out what to do about that. How are they going to help their population? And then on top of all that, we have climate change and the influence of how we produce and consume food on the environment and on climate. I mean, these are enormous, what in public health we would call wicked problems, with many causes and no simple solutions. And I think that's what everybody needs to be working on. That's where the research needs are. That's where the policy needs are. And when I hear RFK Jr. talking about color additives, I think color additives, we should get rid of them, absolutely. But why isn't he talking about undernutrition, overnutrition, and climate change when those are the really big issues? Color
So
additives is a splitting issue.
when you think about some of the issues in, early in your career, you talk about starting really in the 70s, and probably had some insights even before that. But in contrast to the 70s, what do you think are some of the pressing issues early in your career, and how do they differ than what we're seeing right now?
Well, I went through all of the stages, from splitting to lumping. I started out being really interested in nutrients. I thought they were I know I was trained in biochemistry. I thought they were completely fascinating, each one of them with its own, where it comes from, what it does in the body, fascinating stuff in the body. Why do people not have enough of it? Even then I was interested in the sociology of and anthropology of nutrition, is why weren't people getting enough of those individual vitamins? And then at some point it occurred to me that people don't eat nutrients, they eat foods. And then I got really interested in food. And if you get really interested in food, you have to get interested in food systems, because to understand why people eat the way they do, you need to understand agriculture and how food production works. And so that got me into that. And then eventually food systems. So now I think of myself as a food systems thinker, which means that you never could talk about any aspect of nutrition and health without talking about how food is produced, transported, stored, sold, purchased, prepared, and wasted. All of those things are just totally integrated. And, that's not always easy to think about when you're looking at that, but that's what big picture thinking is about. And that's how I think about it these days. But it was a transition. And I have a lot of sympathy for nutrients, what we're now calling nutritionism, slightly pejoratively, which means that when people talk about nutrients and they're using a nutrient to stand for foods, diets, and systems, that's nutritionism, using the part to stand for the whole. Um, I mean, I can understand all of that. I have a lot of sympathy for it. And, since you served on the Dietary Guidelines Committee and I served on the Dietary Guidelines Committee in 1995, and, I think they say the same things now that they did then. Um, I've always been interested that the dietary guidelines talk about food when they want to talk what you're supposed to eat more of: fruits, vegetables, whole grains. But they switch to nutrients when they talk about what you're supposed to eat less of: saturated fat, salt, and sugar. So and that's been a constant, and I have my own ideas about what that was about. But, I'm always amused that the guidelines, for all of the fuss about them, always come out saying exactly the same things. We know what a healthy diet is, and it hasn't changed since 1980.
So in thinking about that, because one of the things as we think about the systems focus, you know, the food system is a large system, and then we think about a healthcare system. So part of this idea about large systems shaping what people eat in America and of course globally. But if we think about the US context, the food system, and then the healthcare system, there's been a focus on, of course, there's many other systems, the education system and others that play an important role in shaping what nutrition looks like, what we eat, how we think about what people should eat and how they get it. But there's been a rise, and this special issue includes a focus on food as medicine. And if we think about sort of that other large system, the healthcare system, what do you think about food as medicine and this rise in direction of incorporating a key focus on food and nutrition in the healthcare system? And then where do you think we should go when we think about food as medicine?
Yeah, I taught at the University of California School of Medicine from 1976 to 86. And I ran a nutrition education program there at the time, one of the few. And by then, in 1976, when I started, it was already 20 years after the first American Medical Association conference on teaching nutrition in medical education. And that conference 20 years earlier had complained that nutrition was absent in medical education. My job was to try to introduce it into medical education. Some success, basically a failure, because of the systematic issues in the healthcare system and healthcare training system that make it impossible to talk about issues related to preventive medicine. But the same issues, I mean, here we are 50 years later and nothing has changed. Doctors still aren't learning anything about nutrition unless they take it upon themselves to join the organization, the American College of Lifestyle Medicine, or whatever it is, where they actually talk about these things. But these are systematic issues that make it absolutely impossible to teach medical students about these very important preventive issues because they're not reinforced at the bedside. There's nobody to teach them. Everybody thinks that nutrition is really simple, Angela. They think it's really simple. Anybody can do it. Everybody eats, right? And then when you start looking at it a little bit harder, it's not so simple. It's in fact quite complicated in a lot of ways, and ways that I think the general eater just isn't really aware of. Medical students are being trained in a system in which every single patient who comes into a doctor is going to be concerned about what they're eating. And whether the doctors are able to respond to those questions or not depends on the kind of training they had and their own personal interest. But there's no systematic development of nutrition education in medical education. So in that sense, the food as medicine movement is a plus because it at least gets doctors talking about food. Now, I think it depends on what you mean by food as medicine. If you mean the program in which physicians are prescribing healthy foods to their patients and presumably finding ways to pay for those foods, that's fine, but that's only going to reach the um, the coterie of patients who have access to the healthcare system. I would say we don't have a healthcare system. You know, we've got a broken system of private insurance and public funding that's just a mess. And it's working so badly that even my very well-educated physician friends can't get a doctor's appointment. So, I mean, there's a real problem with the healthcare system as the basis for food is medicine. And then it's used in other ways. I'm all in favor of encouraging people to eat more healthfully. But if you're going to pay for those foods and give those foods to people, that's not a sustainable system. Because that money is not going to last forever. So I worry a lot about that. I think we need national education campaigns. We need dietary guidelines that tell people about what foods they should be eating in a much, much simpler way than the current dietary guidelines currently do. Although, as you well know, the new administration may pay absolutely no attention to the report that you spent whatever time writing that you wrote. That report may turn out to go into a drawer and never be seen again. Um, so it's very hard to know. I think diets are so simple to explain that I'm fond of quoting Michael Pollan, eat food, not too much, mostly plants. I think that covers it for the most part, particularly if you explain that food means real and minimally processed foods and excludes junk foods or what we're now calling ultra processed foods, or excludes them largely, not exclusively. I would never propose a diet that was free of ultra processed foods. I have my own favorites, and I would never advise anybody to follow a diet that couldn't follow myself. I mean, I eat according to those principles. I find it very easy. Eat food, not too much, mostly plants. I mean, that's easy for me. I wish it were easier for other people. I've got enough money to do it.
Yeah, and thinking about that, because I actually have two questions as a follow-up of that. We know that there's been a shift in our focus on making sure we have kind of nutrition for all, where we used to think and have kind of equity at the center of a lot of conversations about closing gaps in dietary intake across the population based on multiple drivers. Now we're shifting that conversation. How do you think we keep that in the forefront to make sure that everybody has adequate access to those things that are considered helpful or that promote health?
I think that's a value and a principle. And we need values and principles in our lives. They give our lives meaning. And just because somebody doesn't like the words that are being used to describe those kinds of viewpoints doesn't mean that the principles and values aren't there. I think it's, if we're interested in public health, if we're interested in make America healthy again, make America healthy again means everybody. And that's built into it. And that's an inclusive statement, at least how I interpret it. I interpret it as an inclusive statement that includes people who may have trouble because of financial reasons or educational reasons or where they live or whatever the reasons are, don't have access to a reasonably healthy, accessible, affordable diet that's going to maximize their chances for a long, healthy life. Of course, that's what we're going to work for. I don't care what words they use. Those are principles.
Mhm.
And they're certainly principles that drive me. I'm not going to give them up just because somebody doesn't like the words that are being used. And I'm astonished by the word list, by the way, the list of forbidden words, it not only includes inequity, it also includes words like women. Oh, I thought, really? I think I'm interested in women's health.
Yeah, and thinking about that, because the people always have kind of varying perspectives when it comes to whatever dietary recommendations come out, in the past and now. And I know you've been, part of the thinking about, some critique around what comes out when it comes to the dietary guidelines, or I think other dietary guidance is always varying perspectives. But I think one perspective that I think is critical is what you said. How do we make sure that we have policies in place when it comes to improving population health? Because one is to set guidelines, but the other is to make sure that people are able to implement whatever recommendations are in place. What policy recommendations do you have when you think about improving population health, either food systems, healthcare systems that are able to be implemented in the US? What do you think would be the most feasible policies when it comes to improving population health?
Oh, I have my list. And these may be pie and when you say able to be implemented, I assume you mean able to be implemented if the political will is there. So this includes for me, starting with getting money out of politics. We need to elect officials who are interested in public health, not necessarily corporate health or the health of billionaires. So that's my starting point. We need to overturn Citizens United, the Supreme Court decision that allowed unlimited money in politics. We need an agricultural system that is focused on food for people, not as it currently is, feed for animals and fuel for automobiles. And the way I like to explain that is that our current agricultural system, if you just look at corn production, of the billions and billions and billions of pounds of corn that are produced in the United States every year, roughly half goes to feed animals, and the other half goes to be converted into ethanol for automobiles, with a tiny fraction, just a tiny fraction of corn used as food for people, or even ingredients in food for people. It's a very, very small percentage. So I think we need that to change. We need universal basic income so that people can afford to buy food. We need universal school meals so that every child in every public school in the country has access to a healthy breakfast and a healthy lunch. Um, and of course, that means much more money for schools, because the school meals program is the only school program that is expected to be self-supporting. And if it's going to be self-supporting, it's got to have enough money to be able to buy foods for kids and also pay the workers decently. And we need an agricultural system that pays workers decently, and in which farmers make a living. I mean, these may not sound like they're related to what you buy at a grocery store, but if you're doing food systems thinking, then you need to think about these things because they're so closely related. And I think dietary guidelines need to be expressed in ways that are easy for people to understand and are about food and the kinds of foods that people eat. And I wish we had those. And and I've written endlessly about why we don't have those. But that would be part of it. I want a national education campaign that talks about what a healthy diet is and why it's important, and a national campaign to try to make sure that everybody has that kind of diet, accessible, affordable, and palatable, because food is one of life's greatest pleasures. And if people don't like what they're eating, you can have all the dietary guidance in the world and they're just not going to do it. So food has to be delicious. People have to enjoy it. We need food to be enjoyable. So that's one aspect of food as medicine that I don't like, is it's not focused on the pleasure of food nearly enough, in my view.
So when thinking about, you have a new book, What to Eat Now, that comes out in November. What should readers expect from you in your new book?
Can you excuse me for 1 second while I get it?
Yes.
I just, I just was given the Bound Galleys. This is the Bound Galleys. The book is coming out in November. Look how thick it is. 750 pages. I mean, I just can't believe it. It's a doorstop.
I hope it's on Audible. Will we be able to listen
What
to
audible person is
it?
going to read this?
Right.
Anyway, I just got sent the Bound Galleys. I'm very excited about it, and it's coming out in November. Um, and it's as I said, it's. I had written What to Eat in 2006. It's now almost 20 years later. And I thought revising it was just going to be a little editing job. I didn't realize how much things had changed. And I find that, I had to rewrite the whole thing. I was anticipating 6 months to do the revision. It took me 3 years because it's essentially a completely new book, because so much in the supermarkets had changed and I wasn't paying attention. It got by me. So the book has new chapters on plant-based meats. Those are new. On water, having flavored water substituting for heavily sugar sweetened beverages. That's a huge change. There's a chapter on pet food, and there's a chapter on cannabis edibles. I had a lot of fun with this book. Coming out in November.
So, you do a lot. You have the book, you have your blog, and of course, engage in the media in multiple ways. This is probably more of a practical question. How do you pick and choose? I know you have your sort of focus. If you think about the story that you want people to take away, how do you decide what you get involved in as far or activities that you initiate, like the blog and like the book? How do you sort of keep that focus?
Well, I've been writing the blog since 2007. That's a long time to be doing it. I do it because it's at foodpolitics.com. I do the blog because it forces me to keep up with what's going on in nutrition and food. And, it's food politics blogs. So I'm particularly interested in food politics, of which there is plenty right now. There's no lack of things to be writing about, but it forces me not only to keep up, but also to keep up in an organized way. So what I typically do is I read a lot of sources. I put together what there is on a particular topic and I write about it. And then if I need to look something up, that's the easiest place in the world. Blogs have a terrific search engine and you can search for stuff on them. And I think it ought to be the most useful thing in the world for students, because if you've got a topic you want to research, I link to the sources every chance I get. So I've just saved students a huge amount of work. But I do it in a sense for me because of the organization of the thought. It just turns out to be really useful. Since I talk to reporters often and they ask questions, I have an answer because I've written about it. I try to stay ahead of reporters. Not always easy to do, and very hard to keep up with food politics right now when there's so much going on.
So I
But
have just
but
a
I
last.
but I would say the quick answer to your question is I have principles. I write about things that lead to those principles. That my goal in all of this is to get people to become food activists and food advocates. and to go out into their communities and try to make sure that everybody in the community has an adequate, healthy, affordable diet. I think that's worth working toward.
So with that in mind, Marion, what's next for Marion Nestle?
Oh, the
What,
next book.
what's the next thing? Is it a next book? Is it
Yeah,
a, we know you have the blog ongoing. What's next?
the next book is the book about cereals. Oh, I have another prop if that's okay. Um, this is a joke, but I'm writing a book about cereals with a colleague, Lisa Sutherland, who used to work for Kellogg. Um, I've got a collection of cereal boxes. I've actually collected cereal boxes for 20 years, particularly the ones with ridiculous health claims on them. And so I have a whole collection of boxes with immunity claims, children's consciousness claims, heart disease claims, and that kind of thing. And we're writing a book about food and nutrition policy using cereal boxes as illustrations.
Mm,
And that will come out at the end of 2026. It's being published by University of California Press. So yeah, that book's coming along. We're turning in the manuscript this summer. And we've been busy photographing cereal boxes. I know it sounds silly, but because cereal boxes change so much, the companies that produce them may change the designs as many as 12 times a year, usually 2 or 3, but certainly several times a year. They reflect changes in regulatory policy, changes in government rules, changes in culture, dietary fads, celebrities, what celebrity goes on what athlete goes on a Wheaties box, that kind of thing. All of those reflect popular culture. So it's sort of this curious combination of regulatory policy and popular culture that we're mixing together in this book. Every single element on a cereal box is there, either because it has to be there, and that would be, of course, the nutrition facts label and the ingredients list, or because it's there to sell the cereal, and that's what this guy is there for. I don't think it's me selling the cereal, but it's it's there. And so we do a deconstruction of cereal boxes and talk about the policy implications and the cultural implications. That's for 2026. It's been really fun.
So we have a few questions from the audience. The first question is, what should be measured to assess the quality and impact of food-related interventions, and how can these measures be captured?
Well, that's a really good question. It's an evaluation question. And every intervention and every policy should have a research component attached to it. So that to the extent that the current administration is interested in cutting SNAP, the Supplemental Nutrition Assistance Program, they better have an evaluation program attached to that to see what its consequences are, because its consequences are likely to be profound. And if they don't do it, then people in academia ought to be there. I mean, it's interesting. One of the things that's happened is that in the cleaning out of government, they have eliminated at least 2 what are called beltway bandit firms, which are companies that do evaluations for government projects. One of them is ABT, a company that my cousin worked for. He's been laid off and the company's essentially folded. Another is Mathematica, which did a lot of research, which did research evaluations for the Department of Agriculture. Its people have been let go. So I don't know how that's going to work. But what you want to know, let's say you have an obesity intervention. You want to be able to show every step of the process. Let's talk about, the evaluations for soda taxes, for example. So there are several cities in the country that have imposed taxes on sugar sweetened beverages. So you want to know, first of all, are stores selling these products? Did they raise their prices? Did the raise in prices have any effect on people's purchases of those sodas? If they, then you want to know whether the amount of sugar in people's diets went down as a result of um, uh, of the taxes, and you want to know whether their weight changed. It's pretty easy to show what's happening in stores that sell products. It's pretty easy to do purchase data. What's much, much harder to demonstrate is the effect of these policies on body weights, obesity, and chronic disease. That's just harder to show, in part because this is only one intervention and many, many factors influence people's gaining weights. You really need to do a lot of interventions if you want to affect weight. So I think the evaluation is difficult. You have to pick the measure, and your question is very sophisticated. I don't, I think that a lot of work goes into these evaluations, which is why getting rid of these companies that did this kind of thing is unfortunate, because they had the knowledge of how you go about doing this, and the ability to do it.
So in thinking, we have a second question that kind of relates to an area I know you're interested in, and that's climate change. The research on climate change indicates that climate change is changing the mineral and nutrient content of plants. If this is so, should we update nutrient labels?
Well, in order to update nutrient labels, you've got to get the data. So the Department of Agriculture has been the main source of data on food composition since 1909. As the Department of Agriculture has come under pressure, they've done less and less of this kind of work, which to me is a tragedy. But they're the group that does these analyses, picks the foods that are going to be analyzed, looks at them, figures out how many samples you need, does the actual determinations of how much nutrient they have, and then comes out with it. And so one question is, are the methods now that are being used to determine the nutrient value of food the same as the methods that were done 50 years ago, if that's what you're comparing? And if those methods have changed, is your comparison accurate? There have been quite a lot of studies that show a decline in nutrient value with industrial agriculture. Mostly you have to show that with minerals because plants make their own vitamins. And so the soil quality and heat and all the other things that go into that climate change affects, you don't really know what's going on. These are very, very difficult questions to answer. But let's assume that nutritional value is declining. Well, how do you decide at what point, what food, who's going to do that work? How much is it going to cost? Is the Department of Agriculture going to put resources into it? I think those are very difficult questions to answer, and that they're certainly not going to do it now when so many people are being let go. I mean, that's what we're up against. If we want the Department of Agriculture to update food composition data, which I do. I like food composition data. I use it. Then you have to have people who can update those data and then change it, and then tell companies they've got to fix the nutrient values on food labels. Ooh, that's a big one. Not going to be easy.
There's another question that came in. You mentioned emphasizing better nutrition education in a systematic way for doctors, Respectfully, our primary care providers are overtaxed, and doubling their education would on average be a 4% of what us dietitians have. What are some of the realistic avenues we can promote the workforce who already has expert level nutrition knowledge?
Oh, such a good question. When I was working at UCSF, I did ward rounds. And I'll never forget going to a primary care ward round at San Francisco General, which is where all the poor patients went. And the resident who was on duty said, "Oh, I forgot you were coming. We don't have any nutritional problems on the floor today." And I said, "Why don't I just go around and see patients with you anyway?" Every single patient had an enormous nutritional problem. And the students were, and the residents were absolutely stunned when I brought these problems to their attention. They didn't have the first idea about how to deal with them. And I said, "I have a really simple solution to your problem. Refer the patient to a dietitian. Dietitians are trained to deal with these kinds of things." The hospital had loads of dietitians on staff. All they had to do was to refer to a dietitian, and these residents didn't even know that. They didn't realize this resource was available. They didn't know how to use dietitians. They didn't, if you'll pardon me, know how to tell the difference between a dietitian who knew what was going on and one who didn't know what was going on. Some dietitians are better than others. They needed to be able to figure that out. And I was just shocked by it. And this was 40 years ago. It hasn't changed. So that's number one. You refer patients to dietitians. Nothing could be easier. Well, maybe not. Maybe not so easy.
So when thinking about that, because we know that there is a huge gap in people being able to see dietitians, get other resources. We talked about healthy food access. This question is about the importance of healthy food for children. We know that healthy food is critical for healthy growth and development. What is the best way to reach families and parents who may not understand what a healthy diet is and or who don't have access to affordable, nutritious food, aside from government programs, money, which can be volatile?
Oh dear, where do I begin on this one? You know, I'm going to begin again with the big picture issue. I went to a conference at the White House during the Obama administration on food marketing to children when the First Lady was trying to get food companies to stop marketing junk foods to kids. And there was, we broke into smaller groups after the speeches, and a food company executive in the group that I was in said, "You know, I think it's wrong to market our products to kids, and I wish we couldn't do it. I wish we would stop doing it, but our stockholders won't let us." And I thought, oh, okay. So food companies don't want to stop marketing their junk foods to kids because they make a lot of money off of those junk foods. Every attempt to try to get food companies to stop marketing junk food to kids has failed. The first one that I know about was in 1979 when the Federal Trade Commission tried to stop television marketing to kids. And the result of that was that the head of the Federal Trade Commission was fired, and Congress passed a law said you can't do anything about stopping marketing to kids on television. That's what you're up against in trying to help families feed their children healthfully. You're up against a food system that is designed to get kids to eat more of the foods that aren't good for them, not less. And you have a situation in which a food treat is something that even poor families can afford to do for their kids in a situation in which they can't buy them really expensive sneakers or other things that the kids might want. So that's what you're up against. And I think if you're trying to eat healthfully in today's food system, you're fighting the food industry, you're fighting the entire food industry on your own. That's why we need government regulation. That's why we need mandates that require food companies to behave better. And you want families to feed their kids healthfully, they have to know how to cook. They have to have a refrigerator, they have to have a stove, they have to have pots and pans. They have to have the knowledge and the time to be able to cook. That's asking a lot. So one of the questions is, maybe you do prepared meals, maybe you make those available rather than foods that people have to do something with when they don't know how to do something with. It depends on your community. This is one of those things where I think you do classic public health. You go into the community and you ask people in the community what kind of help they need, and you try to get them that help.
Thank you. I know I'm going to ask one last question, but before I do that, I want to put in a plug in thinking about nutrition education, because a lot of that we do through extension. Many people forget about our extension system and policies that support nutrition education, teaching, cooking. Of course, I work in the expanded food and nutrition education program through the extension system, but I think these programs could be expanded. And so part of when you think about cooking and support and resources, there's other resources that can be put in place to help support families in connection with these programs. So I appreciate your comment related to that. The last question that I have is an advice question. There's probably many people on the webinar who want to have a career in nutrition and food policy. What advice would you give to someone who's just starting out and they're interested in working on food policy?
Yeah, first of all, learn as much about nutrition and food as you can. It makes it much easier to design policies if you know what you're talking about. And as I said, I think nutrition is in many ways very complicated. It took me many, many years to understand how to move from nutrients to food. So the more knowledge that you can gain, the better in any way that you want to. In any field that you want to become an expert in your field, and then just start doing it. Find some local community thing where you can get busy. I tell people, if you want to get involved in food advocacy, you Google food advocacy, type in the name of your community, you'll be amazed at the number of organizations that are already there working on it. Join them, work with them. You want to have a really important impact on food policy, run for office. We need good candidates for office who are interested in these kinds of issues. But do it, just do it, and learn what you can, do it. And it'll be fun. Food is fun. You get to eat it.
And so I actually do have one last question since we have a few minutes. And one is about hope.
Uh,
What makes you hopeful when you think about the future?
mhm.
Uh, where do you have and where do you see, hope in your work?
I'm very fortunate. I work at a university. I'm retired, but as you can see, I'm still hanging around. I get to work with young people, and I'm in a department of nutrition and food studies. People come into this department because they want to change the world using food as an entry point into important social and political problems. They want to be able to make the food system better. And that's their goal. How could you not be hopeful when you're dealing with all of these people who want to make the world a better place? I think my role is to cheer them on.
Thank you so much, Marion. It's always good to talk. I know we'll get a chance to actually have a one-on-one and debate. There was a question about the dietary guidelines, and of course, we probably have a lot to talk about.
Well,
And
you're the one who needs to answer that one.
right, or even debate and explore about recommendations for the future. But I'm going to turn it back over to Ellen to close us out. Thank you so much.
Thank you so much, Dr. Odoms-Young, and thank you, Dr. Nestle. And thanks to our audience for joining us. We hope you'll join us again for a Health Affairs Insider event on May 29th, focused on the FDA's first 100 days in the second Trump administration. Speakers include Rachel Sachs, Richard Hughes IV, and Artie Ray. And you can find more information about this event, along with the full Health Affairs theme issue on food, nutrition, and health, podcast episodes on the topic, an interactive gallery for the theme issue, and more on our website, healthaffairs.org. We are now adjourned.